brilliant to see how many of you signed up. Clearly a real appetite to get stuck into this conversation today. So looking forward to hearing your questions and reflections. And I think we're pretty much all in the room now. So huge welcome to you all. And really wanted to start by saying very much a heartfelt thank you for everything that you've all been doing across the last year to support students, to support your colleagues. I know that we're starting to see some positive moves towards seeing each other again. But whilst we're still digital, thank you for making the time in your diaries to be here and join us. And just to do some first introductions, my name's Rosie and I am the Chief Exec at Student Minds. And I'm absolutely delighted to be joined by my co-host Bramman today. Bramman has been an absolutely incredible volunteer for Student Minds, both as a facilitator and then also as a member of our Student Advisory Committee, who are really put student leadership at the heart of what we do. So very excited that Bramman can join us as someone who's really helped to shape the Charter over the last couple of years, and who is now very frontline. He's very fortunate to have you as a social worker as well. So brilliant to be joined by you, Bramman. Welcome. I'm just going to start by outlining the purpose of the event today. So this is really about an opportunity for all of you that are committed to improving mental health of the university HE community to hear more about the University Mental Health Charter programme and find out how that it can support you to achieve cultural change at your university. So a really exciting topic for us. And before I start, I want to say a few quick thank yous, and also we'll do a little bit of Zoom housekeeping. So first of all, I'd like to say a huge thank you to JISC for supporting this event so that we can be with you remotely today. And also thank our funders, the UPP Foundation and the Office for Students, who have enabled us to have the resource to develop this charter. I'd also like to thank, it always feels like there's so many people to thank with a programme like this, but I would really like to thank also our steering group members who have really supported us to get to this important milestone. So that includes our student services colleagues at Moshi, National Union of Students, Universities UK, stakeholders at the Department for Education, and also SMARTN, the Student Mental Health Research Network. But also to say a huge thank you to the whole of the Student Minds team for everything that they've done over a number of years to get us here today. All those video calls over the last year have been worth it, everybody. So thanks for being with us. I'm also going to give you a heads up on who our panelists are today. So we're going to hear from Lee, who is the interim head of engagement at Student Minds and has led the development of the Charter. And also Gareth Hughes, who is the research lead for a number of programmes at Student Minds, and particularly as content development lead on the Charter. And we're also going to have fantastic opportunity to hear from Avril Williams. Avril has been a crucial partner in the pilot phase. So as the head of student wellbeing, supporting that pilot of the Charter Award Scheme over the last year. And there's then going to be an opportunity for you to ask the panelists any questions about the programme. So do start thinking about your questions very soon, but I'll hand over to Bramman to explain a little bit about that.
Morning, everyone. Thanks for coming. So yeah, like Rosie said, we're going to introduce the Charter, how it works, where it came from, but we do want a big part of today to be really interactive. So if you could use the Q&A function at the bottom of your Zoom app, sort of center right, to ask questions throughout the event. Some will be asked to panelists directly at the end, and others will be responded to through the Q&A function, or they'll go towards building our website's FAQ section. So you can use the hashtag #UniMentalHealthCharter to tweet along and share your attendance. And yeah, today's webinar will be recorded and available on the brand new Charter website. So you can find all the information after on the website or through an information pack that's available to download on there too. Links will be sent out as well. So yeah, before we begin, I just wanted to say a few words about the importance of making a real commitment to university mental health. University should and can be a time where students make friends, expand their horizons, and set themselves up for the future that they want and deserve. For me, it was a really, really enjoyable, formative time in my life. And I know all of you work incredibly hard to make them great places to be a part of. But I've also seen firsthand how poor mental health can turn university into a really difficult and lonely place without the right support. It affected my friends, my peers, and thousands of students across the country. It's not an issue that's going to go away on its own. I saw how sort of widespread and deep the issue was as a full-time student in, sort of pre-2020 normal times. And now as a part-time online graduate student, I can see how the pandemic has disproportionately impacted the mental health of students and young people. Staff are burnt out, mental health services across the board are stretched. And it's been a real challenge for students having to cope with just really, really difficult circumstances. So now more than ever is the time for real commitment and action, working together across every aspect of university life to ensure that students and staff can thrive. Rosie, do you want to say a little bit about why Student Minds developed the Charter and where it came from?
Thanks, Bramman. And I think everything you've just said then really articulates why this matters and why everybody has joined us today. I just wanted to share a little bit about how we started this journey. Student Minds, many of you will know, started as a student-led grassroots organisation, and we were incredibly fortunate to work with students, university and students' union staff, lots of different health professionals, types of practitioners, and a real range of organisations who have a stake in student mental health and wellbeing. And so, because we've had that exposure to so many different voices, we've always been very passionate about the power of listening, around creating spaces like these where we come together. And I think for us as a charity, when we set out a few years ago on starting the Charter, it was about recognising that despite the challenges, the sector was moving in a very positive direction in terms of acknowledging the role of a whole university approach to mental health. And I think for us, we really felt that we wanted to build on that momentum and think about how do we sustain that change over the next decade and beyond. That's about the role of leadership, it's about everyday practices, it's about creating supportive communities. So we set about developing and co-producing both a framework and an improvement programme that encourages that collaboration, really stretches us to keep going up for very ambitious changes, and then celebrates excellent practice, which is so key. You just mentioned there, Bramman, like we've all can think of examples of the really positive influence that certain approaches and interventions can have for us. So we very much wholeheartedly believe that by bringing all of our minds together on this topic, we can absolutely reverse the trend in poor mental health. So I think it's probably about time that we heard from some of our colleagues involved in designing the programme. So I'm going to invite Lee and Gareth to turn their cameras and mics on. Welcome.
Thank you, Rosie.
Over to you, Gareth, to start with.
Thank you very much, and good afternoon, everyone, and thank you for joining us this afternoon. So just picking up from exactly what Rosie and Bramman were just talking about, and the reasons as to obviously why a charter we felt was needed at this point, and the work that we've put into bringing it together as we're presenting it to you today. So if I can have the next slide, please, Lee. So in terms of the impact that we're seeing overall, obviously many of the people on this meeting today will know a lot of the statistics, and I know a lot of the challenges that have been presented to the sector. Even before COVID, there was a rise in the number of students needing support and seeking support from support services, and we were seeing worrying kind of research and statistics suggesting that there were an increase in not only in the number of students needing support, but also in the complexity of issues that we're presenting to universities and that students were experiencing in terms of, complicated life circumstances and comorbidity of different conditions and so on. It was part of the background and part of the conversation, but if we can go to the next slide, please, Lee. I think alongside all of that is, for us, that isn't the whole picture. That obviously, as Bramman was saying right at the beginning, he had an excellent experience of university right from the start, and that actually that is the thing we should be looking for all of our students and indeed for our staff, that universities really, in order to be able to fill all the functions that universities are there for, all of the purpose that we have as universities, that really they should be places that are good for the mental health of our communities. They should be good for the mental health of our students, our staff, and anyone else who are kind of stakeholders within the universities. So absolutely, we should be working towards supporting those who are experiencing problems with their mental health and doing everything we can to eradicate that. But that alone is not enough. We also should be doing things that actually help to make our communities really good for the mental health of all of us who are based within them. So if we can go on, please, Lee. So our vision then, on the basis of that, is that we work with universities and we help universities as a community work together to create whole university approaches that promote mental health and well-being. And what we're contributing, we hope, is first of all, an evidence-informed framework that helps us through the charter framework, that helps provide a reference point, some guidance and some evidence to guide universities towards what good practice might look like. A program in which we can all come together and share our experiences, share the recent most up-to-date evidence, share innovation, so that again, we can create ways forward. And then this voluntary accreditation program, which will be the Charter Award, which will then recognize those universities that have done the really excellent work that is taking place out in the sector, so that they're able to be seen, to get the recognition for the work that they have done. And if we can go on, please, again, Lee. So in terms of the charter, many of you will know this, but I think it's worth recapturing for those who maybe are joining for the first time, that we took an awful lot of time and effort to make sure that the charter framework document, the document that outlines the themes that are covered by our whole university approaches and what we might want to think about doing, it was really grounded in evidence. And that was evidence from the literature, from research, and also from the real experiences of staff and students in universities. Next slide, please, Lee. So we went through a really rigorous process of working with the evidence, working with the research, consulting with staff and students right across the HE sector in all parts of the United Kingdom, going through a rigorous peer review process, working with expert panels to make sure that the charter that we had in the end was reliable and solid and that we could definitely build on. And if we can go again, please, Lee. So some of you on this call today may even have been part of all of that work when we were working on this through 2019. And we went to all 4 nations across the UK. We went north, south, east, and west. We spoke to hundreds of people. We had surveys that gathered the feedback from thousands of staff and students across the sector. And we brought all of that together into the Charter Framework document. Since then, we've been working on actually piloting how then we measure that within universities. How do we actually work with universities to assess whether or not they are working towards the principles of good practice within the charter? And we piloted that at 3 universities, and we're very grateful to the University of Derby, Hartpury, and Glasgow Caledonian, which is where Avril's from, who helped us and did a huge amount of work to help us understand what was working and what wasn't through all of that. And then on the back of that, we've developed this charter program because we recognize that actually the leap from the framework document just to the award, actually we needed to fill in some gaps in along the way, and the program is the way we're hopefully going to do that. And then we have open for applications, which is why you're all joining with us today. And if we can click on again, then please, Lee. Really important, as Rosie said at the beginning, that this is actually a whole sector approach. This isn't just Student Minds working on its own. We've been working with all of our steering group members, as she mentioned. The Charter Framework document was endorsed by the British Psychological Society. We're very pleased about that, and is being supported by a whole range of sector bodies. You can see some on the slide here today. Obviously, JISC are supporting us today as well, which we're really pleased about. And also even some of the staff unions also supported the charter when it was launched. So we've been really pleased to have that whole sector support, and that we've worked to make sure that this was something that the whole sector felt ownership of, and that we're all working together towards something that we all think is important and want to achieve. And if we click on them, please, Lee. So what is this whole university approach? You've heard me and Rosie mention a little bit about that already. And what we recognize is that everything that surrounds us in day-to-day life, everything that we experience, has an impact on our mental health and well-being. And so for universities, what that means is that our staff and students are experiencing impacts on their mental health, positive and negative, in their life in university. So that all universities really already have a whole university approach to mental health. It's just that some of it is conscious and well thought out and is hopefully having a positive effect. And other things we might not have thought through quite as clearly and may therefore be having a negative effect without us realizing it. So we need to be thinking about all those aspects of the way in which we experience the world and experience our time in university, our physical being, our cultural, social, personal, all of those aspects of university life, and the way in which that's interacting with our well-being. And if we go on, please, Lee. And I think the way that breaks down, now there's a number of ways in which you can break that down and think about it, and we'll talk through the way we've attempted to do that within the charter. But I think at the kind of the smallest way we can talk about it is that there are three key elements to this. So we need to, first of all, we need to make sure that the environment is right, so that the day-to-day environment and culture and practice that surrounds people is just good for people's mental health, that is generally a good, nourishing environment to be in. We also need to be working to kind of promote good mental health and helping to empower staff and students so that they're able to take the actions that are available to them to promote and look after their own well-being. And then on top of that, for those people who do then experience problems with their mental health, we need to make sure we've got really well-resourced, effective, safe, well-governed, accessible services that are going to be able to help and support them. So we looked at then how that then breaks down across the way in which we've presented the charter. So if we can just click on, please, Lee. So again, really important to say this is a whole sector approach. So we work really closely with Universities UK. Many of you will be aware of the original step change framework, which is now the mentally healthy universities framework that Universities UK have. And we work together really closely to make sure that we had the same shape, structure and domains within both the charter and the mentally healthy universities framework, so that we're all speaking with one voice and we're all working towards one end. And again, please, Lee. So there are a number of domains. There are 4 domains in total within the charter framework document. And then on top of that, we have a number of enabling themes, and those are the themes that underpin all of our practice. So our first domain is learn, and this is about the learning experience, particularly of our students, looking at everything from how we're supporting our students from pre-entry, from their first contact with us, all the way through transition into first year, the learning, teaching and assessment experience they have, because we know that the curriculum can have an impact on well-being and mental health, and then how we're supporting students to progress from level to level, year to year, and then out into the world after university. And again, please, Lee. Our second domain then is support, and that's about the support services, particularly that we're providing to our students. We'll talk about staff in a moment. Making sure that those support services, as I said earlier on, have the appropriate resources, that they're accessible, that students can get appointments when they need it, that they're safe, that we're able to manage risk when it appears, and that it's well governed, that it's all well managed, and that it then links up into those external partnerships outside of university, so NHS, social care, the third sector, and that we are sharing information appropriately and well within the university as well, so that there isn't a breakdown in support between different parts of the university. And again, please, Lee. Really important that staff well-being is also a key part of the charter. The staff well-being and student well-being is absolutely interrelated. They impact on each other. But staff well-being is important just because it's important. Staff are important within the university community. And therefore staff well-being, and again, all of those things about how environment supports good staff well-being, how management supports good staff well-being, and how staff development can help staff to manage their own well-being, and also be able to respond appropriately within the boundaries of their role to presentations of student mental illness or problems with mental health. Again, please, Lee. And then the whole aspect of living within the university environment. So that's the whole, everything from where students are living, how social integration and belonging works, both for staff and for students, proactive interventions for staff and for students, and how the physical environment actually works to help staff and student mental health and well-being be as good as it possibly can be. And then we have our enabling themes, and if I can have that slide, please, Lee, which is about leadership. So how leadership and strategy and day-to-day policy, not just the mental health policy or strategy a university may have, but how all the other policies and strategies impact on well-being. How well students are included in kind of co-creation work, how well their voice is heard in making sure that well-being and mental health is thought about and protected. How cohesive work is right across universities, not just within student services, but how support works right across. How inclusive a university environment is, and how much that sense of belonging is felt right across the whole community. And then in the research, innovation and dissemination, this is specifically about work to research and innovate around support for mental health and well-being, and disseminating that out to the sector so that universities are supporting each other and supporting all of us to understand what it is that we actually need to do across this whole area. And again, please, Lee. So the key thing around all of this is what we're focused on are principles. This is not a prescriptive thing about this is how you should meet do this. We recognize that universities are very different organizations. We've got small specialist providers going through to some very big providers overall, some very big universities with a much broader mix in student population. So it's important actually that interventions and the action that's taken around mental health is specifically designed for that university, that population, that cohort, and that community. And so what we've done is we focused on principles of good practice. And if you can flick on again, please, Lee. And what those principles allow us universities to do is to really focus in on what's going to work for you, what's going to work in your context, not what works in anyone else's context. How do you make sure that you get this working for your community, for your students and your staff? So what we look at are the principles, not about prescriptiveness, because if we did that, actually what we would do is end up with practice that wasn't really helpful. So this is really about you thinking about the evidence, thinking about what we've presented, and then figuring out how it works in your context. I'll hand over to you then, Lee.
Well, thanks, Gareth. Hi, everyone. I'm Lee, Interim Head of Engagement at Student Minds. I've been leading the development and implementation of the Charter over the past couple of years. So first, a bit about our approach, I guess, to the programme and the award. So what principles are we applying in approaching designing these programmes? So the first is collaborative. I mean, these are the 4 values that really run at the heart of Student Minds as well as a whole, but really work well in working with universities through the pilots, and we came to these as well. So collaborative is the first one. So bringing together university communities to identify and share practice as part of a respectful, supportive and inclusive community. So we want this to be something that's done with the sector, not done to the sector. Courageous as well. So this is all about understanding that to truly change and to truly improve, and that takes courage, that takes vulnerability to understand where your weaknesses are, where the challenges are. And we know there are challenges and weaknesses across the board. Nobody has a perfect approach to mental health and well-being. So we need to create spaces where universities, staff and students can acknowledge where those weaknesses are, where the challenges are, and really be courageous in pushing boundaries beyond the kind of baseline requirements to really be ambitious with what we want to achieve together. Empowering as well. So we want to empower universities to improve themselves, similar to why we're taking a principled approach. We don't want to tell universities what to do. We want them to kind of figure out in their own way what works for them and their communities. And we want to make sure that student and staff voices and those that are often unheard or underrepresented in university communities are really at the heart of the process as well and what we're doing together. The fourth is innovative. So this is all about using evidence and expertise to facilitate collective learning. So through the programme, you'll have a chance to connect with experts around this area and research around this area. And that's all reflected in the framework as well. But also bringing in the peer assessors to kind of reflect on your approach with you as part of the award and we make sure that, you know, they have the right kind of expertise to help and guide you to think about how you could better improve. And also sharing good practice across the sector. So making sure wherever we have excellent practice identified, that this is really used to kind of spread and create and help other universities to improve and challenge themselves as well. There we go. Okay, so now I'm going to talk to you about the Charter programme and all the details around that and the award and how you can apply. So the aim of the Charter programme is to bring together universities who are committed to a whole university approach to mental health and wellbeing to support them to create long-term cultural change. And the programme runs on an annual cycle, so the first cohort starting in September 2021 and running until the end of August 2022. So what is the programme and what benefits can members access? So first of all, members form part of a UK-wide peer support and practice sharing network. And this comes from one of the key things that pilot universities said they would most benefit from is linking up with other universities going through the same process and trying to improve their practice towards the Charter and learning from those who've been through it before as well and have some excellent practice and case studies that they can share with them. We also know that there's no one-size-fits-all approach to mental health and well-being. And one of the best sources of learning is when people have open spaces to share practically what works or doesn't work from one another. So we really want to create those spaces as part of the programme. Members can access practice sharing events. So there'll be 4 of these per year in person where possible. Hopefully we'll be able to achieve that in the next academic year. And they'll all be focused around key themes within the Charter. And these are themes where members have identified key priority development needs. So we'll bring in external experts where appropriate, but the main focus of these will be opportunities for universities who can invite staff from across the university to share how they've been practically implementing the principles of good practice within the Charter. One of the ones we've identified already is an event to support university clinical services to work with the wider university and their leadership teams to really understand and implement good practice in clinical governance. And others include co-production with students and wellbeing in the curriculum. As a programme member, staff across your university will have access to a members area of the Charter website. So this has a number of modules to support you to learn more about the Charter and prepare for the Charter Award. So each module will have a video and some digital resources, and you can also sign up to some live online workshops where you can also link up with others who are working towards the Charter Award in those spaces as well. You can connect with the Student Minds Charter team. So members will be invited to meet with the Student Minds team twice per year. In the first meeting, we'll kind of hear about your progress and start to agree a time frame for when you might want to submit your award submission. And we'll also use those meetings to kind of reflect on your progress towards the principles of good practice and how you're embedding those across the whole university as well. And of course, programme members will be able to submit for the Charter Award. And the Charter Award is all about helping you to better understand what's working, celebrating the good work you have been doing towards the Charter, and recognising those universities that have started to really demonstrate excellent practice in this area. And we want to be flexible around you and when you feel you'll be able to submit for an award. So there's no kind of set time frame or deadline from joining the programme. However, we do think with the necessary commitment, even if you're starting from scratch, we expect you should be in a position to submit for the award within 3 years of joining the programme. But we'll figure out all that in meetings with the Student Minds team with you. After you've been through the assessment, universities will remain on the programme to keep learning from others, keep improving their practice, and then working towards their reassessment so that they can attain that kind of higher levels of the award as well. So a bit about the award itself. So the Charter Award is an accreditation scheme. It brings together university staff, students and assessment teams to assess the university's progress against the principles of good practice within the University Mental Health Charter, understand better where the areas of strength and development might be so that it can inform your own ongoing improvement, as well as learning from that being able to be shared across the sector and inform their ongoing improvement as well. And it's also, like we said, to recognise universities that demonstrate excellent approaches to student and staff mental health. So the whole process will be led by one award lead and one student lead that are nominated from your university. And the key point of contact will be an award manager at Student Minds. The process, first of all, involves a self-assessment that the university must complete, and that's where it outlines its approach to the principles of good practice against each theme of the Charter and provides any evidence or reflections demonstrating that they know their approach is effective. Like we've said before, like we know there's challenges in this area. We know no university has got an absolute perfect approach to mental health and wellbeing and got it all figured out. So we also, in the self-assessment, want you to reflect on some of the challenges that you've identified in your approach as well. The student lead at your university will also have the opportunity to submit a student-led assessment. Next, a team of peers from across the sector will review this self-assessment. So it's a team of 3 peers. There's somebody with clinical expertise on the assessment team, as well as someone with strategic expertise within a university. And there's a student assessor on the panel as well. The assessment team will then come to the university for a 2-day on-site visit, where they'll meet groups of staff and students to explore the university's approach to key themes within the Charter, and you'll be able to reflect on the university's approach together with them. You'll then receive an improvement report with the assessment team's recommendations for improvement and any areas of excellent practice that they've identified, and that'll be against each of the themes within the Charter. The assessment team at this point will also recommend an award outcome to the Student Minds Award panel, which they'll let you know about. And then an award panel will meet twice a year to validate the awards, and the award panel is made up from externals in the sector as well as Student Mind staff and a student as well, to kind of validate all the award recommendations that are being made to them. If you receive an award, you'll be able to use the charter map on your university communications and marketing, and you'll be recognised as an award holder on our award holders page on our website. As an award holder, you'll remain on the programme, like I said before, to access programme benefits to support your ongoing improvement. You'll have an online progress report that will help you and the Student Minds team work together to monitor and inform your improvement process and help you to prepare for the higher levels of the award. So once you've been through assessment, then you'll have to go through assessment again in 5 years. So it's a 5-year cycle in order to maintain or improve on your award status. You might be able to go through it before the 5 years. We've picked that time because through the pilots, a lot of the recommendations were quite big strategic changes that take quite a while before action starts to be demonstrated within practice. So we felt that was a reasonable time frame there. But again, through the progress meetings with the Student Minds team, we'll be able to discuss and create a kind of time frame that seems to work for your university too. Okay, so a bit on the award outcomes that you could possibly get. So there's award first, and then no award. And there's also award with conditions in purple there. So that's where the university is almost there and might be able to make the changes within 12 months to reach award level. And then these universities will undertake a light touch reassessment within 12 months to hopefully update the assessment team on the progress they've made towards some of those key actions and be at award level. So we don't actually expect many, if any, universities to be working at award with merit or distinction at this stage. These are definitely aspirational, and they're intended to provide universities a standard to work towards, and so that they're continually improving beyond that first award level. So next steps. So universities can apply online by following the link on the Charter website, and we'll provide all these links in a follow-up email after this webinar. To apply, you'll need to meet the eligibility criteria. So first of all, you'll need to be a UK-based degree awarding university. You'll have to have a signed letter of support from the university's VC or equivalent, and more information about those requirements and what needs to go in the letter for support can be found in the programme information pack, which you can download on the website as well. Again, we'll send you a link to that after this webinar. The next, we kind of want to celebrate the first universities to commit to this work and invite you to join us with that as well. And we know that this year has been really tough for universities, and particularly how they've been presented in the media. So we wanted to provide a bit of a positive news story at the end of this year to kind of celebrate how the sector is responding to the growing mental health crisis and how they're coming together to invest and improve mental health for the staff and students in their communities by joining the Charter programme. So to do this, we'll be announcing the first universities to join the programme in July this year. And if you'd like to join us in this announcement, then you should apply by the 1st of July 2021. The final deadline to join this year's cohort is the 1st of September 2021. And then the programme will begin in September, and we'll start by giving you access to the members area and arranging a meeting with the Student Minds team to kind of meet you, you can update us on where you're up to in this work so far, and start to think about what a timeline for submitting for the award assessment might be. Okay, so that's all from me. I am now going to pass to Avril Williams and invite you, Avril, to turn on your camera and microphone. You're going to provide us a bit of a flavour of what it was like to go through the pilot of the award from your experience. So take it away, Avril.
Thanks, Lee. I would say our approach, we started by looking at, with the University UK framework, we started looking to develop our whole university approach to mental health. And this started really around about the summer of 2019. We appointed a project officer, and we felt that if we were chosen for this pilot, it would really give us a step-by-step guide as to how we could take this forward. And also really, as Lee was saying before, you know, it's almost like a critical friend coming along and trying to help you with your areas of development and recognising where you are maybe doing a bit better. What I would say is that it's been invaluable, as it's made us look at a truly whole university approach, and I think that's part of, it's much easier to get attraction across our institution when we were talking about the Student Minds Charter. What I would say is this does not sit in student services. You'll be glad to know it was truly a whole university approach. We had around 14 subject areas, senior people within the organisation who came together as a group. That was Director of HR, outreach team, academic quality. It really did involve the whole university. Each took an area, and it was they then went away and looked at their area and how the charter worked in their area. And I think it really did. We went into great detail across all areas of our university as to what we did, and I think it really helped us highlight areas where we could do better and where we were doing quite well. And I think it also highlighted where we needed to focus resources, and that was about staff, but it was also about data gathering, management information, and understanding what it was we were doing in that area. And I think also for us, it wasn't just about a charter mark, it was about knowing that we're taking the right approach, and that by doing that, we can support student mental health across our institution. Also now going through the pilot, we are working on an action plan. We are keen to continue to participate in this award, and I think it really has helped us focus on what we need to do to improve, and I really can't recommend it highly enough. I think it really has been a valuable input into our whole university approach to mental health. So that's about all I've got to say in that moment.
Thank you very much, Avril. And I think that really brings to life what the process is like, and adds that really helpful context for what my colleagues Lee and Gareth were describing. Brilliant. And thank you to everybody at your institution for fully participating in that process. So we have now got the opportunity to take questions for all of our panelists. So I know we've had a couple come in already. Please do feel free to use the question function on Zoom to get those questions coming in. I think we'll take a few in bunches. So there was two questions I want to pick up initially, and I'm going to come to Gareth first. So there was a question which has been asked about how much intersectionality has been considered within the Charter. So thinking about this through the lens of range of disabilities, social class, ethnicity. So that's really about the approach, about the content as well. And then there was also a question about how this connects in with the Mental Healthy Universities framework as well. So Gareth, do you want to start with those two, and then I'll bring others in?
Yeah, absolutely. So if I pick up that first question, the intersectionality and inclusivity are absolutely really important to the Charter, and that came through all of the consultation work we did when we were building it. And you'll see that one of the themes looks at inclusivity and intersectionality. I would say in each of the themes within the document that there's not a lot of text to each one because there was so much that we had to cover. But we recognize absolutely that different people experience universities in different ways, and that can have an impact on well-being, either positively or negatively. So yeah, it is something that is a crucial part of the framework. It's also something that we absolutely look at in the assessment, both in the written submission and in the on-site visits, to make sure that the environment is open, embraces cultural diversity. It's a place to which everyone feels that they can belong and that they have a role, and that universities are considering the different ways in which day-to-day practice might impact on different people depending on background, characteristic, experience, and so on. In terms of the UK Mentally Healthy Universities framework, really they're kind of both versions of the same thing, to be honest. If you're using the audit tool that was developed for the Mentally Healthy Universities framework to help you think about your practice, that will help you prepare for the Charter. It won't necessarily cover every aspect of it, because the Mental Healthy Universities framework was developed really for leadership, to help them think from a leadership perspective. But really, it's the same work, looking at the same domains and ideas and enabling themes. And we worked very closely together to make sure that that was the case. So you can think about them really as just different, the same thing, just told in slightly different ways.
Thank you, Gareth. And also, I'm going to go on, actually, I think that's covered those questions really helpfully. I'm going to go on to the next question. So we have had some questions about the audit process. So let me just check the phrasing for this. So someone's asked, the assessment team's visit is a kind of in-person audit at the institution stage of development. And also, where will those events as part of the process be held? Do you want to pick this up, Lee?
Yeah, absolutely. So yeah, the assessment team, the on-site visit is like you might be familiar with other kind of audit processes that happen. The assessment team will come to the university campus or wherever you're based for 2 days, and we'll host a series of panels and focus groups. So the panels will be based around the domains of the charter. So there's a learn one, a live one, a support one, and a work one, as well as a couple of the key themes, such as there's a student voice and participation one, because we know that's so core. There's a inclusivity and intersectionality one as well, because again, that's something that we want to spend a little more time exploring with university staff and students there. And we'll ask the university to invite key staff who can speak on those areas with the assessment team and help to reflect on how's your progress so far, and where are your areas for development, what are your future plans, and really have a conversation like that with the assessment teams. There's also 2 focus groups, one for staff and one for students, so we can get a feel for what is the experience of being at that university as well. So yeah, that's the visit. And for the events, I think that was a question about the in-person practice sharing events on the programme. I think it was from somebody who's based right at the north of Scotland. The intention is that we will move around with those. We'll see how the first programme goes, the first year of the programme goes, and get feedback from that as we're developing as well. So it might be that people would prefer more local and more regional, smaller events. So that's something that we can keep in mind in the future. But the first few we'll try and mix up. So we're working across the UK in locations where people can kind of easily access initially.
Thanks, Lee. And I think there's some questions coming through around student voice as well. Do you want to pick that up, Bramman? I have to do the classic, you're on mute, Bramman. Thank you.
Sorry. Yes, students have been involved in the charter process in lots of different ways. So firstly, the Student Advisory Committee, which I was a part of, was really heavily involved in the sort of initial mapping, involved in advising student minds on the direction and the shape of the charter from the beginning. So that was not only thinking about what the charter would look like, what sort of things would come under the sort of assessments, but also importantly devising what student engagement would look like as the charter continued to develop. So things like how and when to involve student unions, thinking about using additional specific focus groups on the road trips to gain feedback from underrepresented voices, and things like that. And then in the later stages of the framework as well, in the assessment stage, co-production is still a really key theme of the charter. So Student Minds held a charter student panel which created resources for students to support them to use the charter and to make recommendations of how to involve students more. So this was things like workshops for students to create campaign goals, and helping students use a self-assessment tool to evaluate their universities. And based on that panel's recommendations, each university will have a student rep who would help to coordinate the award. So I think Lee mentioned earlier that students submit a report alongside the university's self-assessment, and the assessment team itself speak to students in those on-site visits. And there's a student on the assessment team as well. I've just noticed there's another question I might throw to you, Avril. Do you have any examples of practical examples of pieces of work that were done during the pilot scheme?
In terms of the pilot process?
Yeah.
In terms of practical work, I think to help the process, we had a student project officer, and the project officer for student mental health, and I think it's really important that you have that key person at the centre to coordinate it all and to make sure that that's happening. And I think we mapped the process before we started going through the project to make sure that we were covering all areas. And I think it's also really important that we had some students as well help us write it and review it and read it, because I think that's really important as well. When you were saying, you know, it's not just about what we're saying and doing, it's what our students are saying and doing as well. So I think that's really important to have that person at the centre and coordinate it, but to have lots of experts feeding into it as well.
Brilliant. Thank you very much both. So yeah, I think you can hear there that student involvement is absolutely integral, and again helpful to hear, Avril, about the particular post that supported that at your institution. Brilliant. So I'm going to actually, I guess, building on some of the technical questions, there's a question that's come through about the peer assessors. So how will the peer assessors be appointed? And will this be about volunteering their time? So perhaps Lee, to start with this one.
Yeah, absolutely. So peer assessors, it is a paid role. We started with the pilots with people that are part of our network or our clinical advisory group who we work with consistently and are already familiar with and involved in developing the charter as well. So that worked really well. But obviously, the more universities that go through the award, we will be looking to recruit additional assessors. So absolutely, if you know anybody or you yourself are somebody with a clinical background or have been involved in a strategic role at the university, developing your university's mental health strategy or similar, or even a student with an interest in this area, perhaps you've been a student officer or a representative or a campaigner, there will absolutely be in the future opportunities to come and join us as a peer assessor as part of that process. And it'll be a similar recruitment process will involve applications and interviews and training with us as well to ensure that assessors understand the framework, understand the process, and are kind of making judgments that are kind of broadly similar across all the different universities that they assess as well.
Brilliant. And I don't know, Avril, about if you've had any interaction with the assessors. I don't know if you want to add anything to give a flavour of what that was like.
Yeah, I think it was really helpful, and I think, you know, the assessors were people just like us and roles just like us, and were able to ask those questions. And I think it felt really good that they understood when you talked about something, they understood it within their institution or within their roles. So no, I think it was a really interesting discussion when we met with them. It was a really interesting process.
Brilliant. Okay, I think we've got time for another question, so I'm gonna get everybody involved with the final one. So there's a question here which I think is very thoughtful about when is the right time to apply, essentially, if I distill it down. I've just found the exact phrasing. So someone basically said that they're very keen to sign up, but should they wait until they feel they're in the best possible position to apply, or should they apply from where they are right now? Good question. Gareth, do you want to kick this one off?
Yeah, I think that I completely understand where that's coming from, having worked within a university for many years myself. And I don't think there'll ever be the perfect time to apply. And it's one of the reasons we have actually established the program, because what that's there to do is to help you get yourself into the best possible place to apply for the award. So I think what I would suggest is that you know, if you've been working on this and thinking about it for a while, it's probably right for you to apply for the program. There isn't a pressure on you to then move through the program quickly to the award if you need to take more time, and if through the program you're identifying there's more work you want to do and more things you want to get in place. You can do that, and you can work with us through that program and learn from all of your colleagues in other institutions to help you think about that, to help you think about what you want to do and where you want to be at the point at which you apply for the award, so that you're in the best possible place. But I completely understand there will always be, whenever you're looking across, something else you could do, something else you could develop. But that's what the program's there to also to help you to do, to make sure that you are thinking everything through and developing in the direction that's right for you and your context and your institution.
Brilliant. Anyone else want to add to that? I might cheekily squeeze in another. Avril.
No, I just want to reiterate what Gareth said, do it soon, because it really, really was helpful for us, and we weren't perfect. We've got areas that we need to develop, but it's been really, really helpful.
Brilliant. And Avril, you and your team have been taking part in this during a pandemic as well. So I suppose it's highlighting that, added another layer to it, I suppose. Yeah. Brilliant. We've had another question about students' unions, and I would like to pick this up. So I guess a question about how students' unions can engage. And Lee, I know because you also work with colleagues at Student Minds on our Students' Union programme. I wonder if there's something to give colleagues a flavour of how they think students' unions can be best engaged with this process.
Yeah, absolutely. I've just been working on that this morning, talking to our SU programme about kind of what this means for SUs and how they can get involved in that as well. And there's a number of ways. I guess the charter framework itself is really useful if you want to create positive change in your university as somebody who works in the SU. It provides a framework for listening to students if you don't know quite what to ask them about their experience. There's a framework there. It's got loads of evidence-based kind of recommendations for the direction universities should be going in and what work needs to be done right across the university. You could use it as a tool to kind of work with the university and ask them, how are you applying a whole university approach? What is your kind of strategic approach to mental health and wellbeing across the university? Or even use key themes. So there's a whole theme on just accommodation. You can use that to work with accommodation providers specifically and really work to kind of develop how they're supporting mental health and wellbeing. So there's lots of different ways the framework itself can be useful. And then in the programme as well, we want to make sure that we're right from the start. So like we say, we'll have a key contact from the university that's a staff member, but also a student representative as well. So that whenever we're doing any kind of these practice sharing events or anything like that, that we're considering students and their involvement and ensuring that they're able to share and join in the conversation as well. But as well, so as part of so that might be a role from the SU, and we would encourage that lead student is involved in the programme there and works with the university in partnership through this process and are involved all the way. And the award itself, we will need a lead student representative as well, who will be involved as the staff member in coordinating that award process, in coordinating the submission and feeding into that, as well as producing their own student-led submission if they'd like to do that as well. And then involved in working with us to invite students to the panels on the on-site visit and the student focus groups. So there's lots of different ways that we would encourage universities to work with their student unions, definitely in partnership when working through this process. And of course, the student voice and participation is a key theme of the charter. So we expect universities to be demonstrating how they're involving students in creating their strategies, in developing their services and beyond as well.
Brilliant. So lots for student union colleagues to get stuck into as well. Fantastic. I can see also there are some questions, people asking about where they can go basically for that next bit of information. So find out about the fees, find out about how they can participate. Please do go onto the link, and you basically download an information pack. You need to fill out a form to download the info pack, which has got all that information. That's so that we can contact you, we can stay in touch with you over the weeks ahead. So hopefully all of you will get onto that following the webinar. Brilliant. So I think I can just want to say a big thank you, Gareth, Lee and Avril, and you are free to turn off your videos and relax, and just for me and Bramman to do a final little wrap up. So do you want to kick us off, Bramman?
Yeah, thanks everyone for attending, for all your interesting questions. If you do have any more that we didn't get around to today, just send an email to charter@studentminds.org.uk. I think it's on the slide there, and we'll use them to inform the charter FAQ on the website, because I'm sure if you're wondering it, then lots of other people attending will be wondering too. So please do send us an email.
Brilliant. And just to give you a reminder as well on the timeline and how it is that you can go about applying on the slide here. So we would be needing to receive applications via the Charter website by the 1st of July. And that is if you want to be included in the announcement of the first universities that are joining up. Otherwise, the deadline is September 2021, and that's when we will have lots of this fantastic programme activity that my colleagues described kicking off. So hopefully today has helped you to get a really good sense of why this matters, how we've gone about developing this process, sharing that learning from Avril about what that assessment process can be like, and starting to unpick what some of the key questions will be across the sector. You've been an incredible audience today. Those questions have been so thoughtful, and do take up Bramman's offer about email if you've got any that you're left with today. I also want to just say a big thank you to JISC for sponsoring this event. It's really an amazing opportunity to be able to connect with you in this way, and we will also look forward to when we're going to be able to see more people in person in the future. So yes, it'd be nice to see some smiling faces or some thoughtful faces at a future event. And also, I think, Bramman, we just wanted to thank a few others.
Yeah, thanks to all the panelists, Avril, Gareth, Lee for speaking, Rosie for having me, Amanda and Zoe for the technical support behind the scenes, and for everyone who's joined us today. There will be a recording available on YouTube if at times we went a bit quickly to rush us in through the hour, but please share it widely with your colleagues as well. Have a good week, everyone. Thanks for being with us, and Eid Mubarak to anyone who's celebrating as well.
Thanks, Bramman. Thanks all. See you again.